Good morning to everyone out there, and welcome to the fourth webinar in our webinar series, Aseptic Techniques. Thank you guys for all joining us this morning. My name is Matt Fensky, and just doing some quick introductions here as the Business Development Manager. We are encouraging you all to participate with our team today. So Lauren Ellie, our technical liaison, and myself will be back answering questions on the chat function as well as the Q&A function, which we encourage you guys to use throughout the presentation today. And Allison MP, our technical specialist in lab operations, will be our presenter today. So as I had mentioned, we really do encourage you to be asking questions as we go through today presentation. So utilize those couple of different options to be able to do that, and we will answer them as they come in. So without further ado, Allison, I'll let you take over here.
Okay, good morning, everybody. Today we're going to be talking about aseptic technique. I am going to be not solely focused just on micro. We will be talking about some basic micro sampling and testing, but we will also touch on some of the more typical chemistry tests that you may be performing in-house. So when we talk aseptic technique, that's actions and practices to reduce contamination or prevent cross-contamination. And that isn't just when you are in the lab setting up samples. That is when you are in the plant taking your sample, when you're getting that sample ready to either go to your lab or getting ready to be sent to us. And then also when you are in the lab testing that sample. So it's a very wide encompassing thing that you really want to think about start to finish. And key takeaway on that, the result is only as good as the sample taken and tested. Again, we'll talk about that beginning to end, and just, reiterating the fact that as we talk about the sampling, not just taking the easy sample, but taking a really good representative sample. So when we talk sample collection, thinking are microorganisms homogeneously distributed. In a perfect scenario, you would take sample 1, and if something was there, you would find it during that testing. But in reality, that's not how it goes. In a block of cheese, you could have it in one corner and not in the other corner. So is taking a single sample representative of the entire lot? That's obviously kind of a balancing act, because we know that most samples, most products, it's not homogeneous. It is kind of clumped together. And obviously you can't test 100% of your product. There's time involved, there's a lot of money involved. So making sure that when you do get that sample, that you try to take a representative sample. And that's where really following all procedures, all steps, no shortcuts, that really helps you get to that good result and hopefully finding it if it is there. So when you are taking a sample, again, this is prior to it going to the lab. So this is more likely in the plant, whether it's an environmental or a product. The key is you really want to protect that sample from any sort of change and protect that sample integrity. So the types of containers used, whether it's a Whirlpack bag or it's like a custody vial, making sure that they're good quality, they're leak proof, you're able to close and really seal those bags very well to prevent leaks. And then making sure that you keep those refrigerated. Because when we talk a little bit further on, those bacteria are going to just start to replicate. So really making sure that you keep those refrigerated. And something to keep in mind too, if you're out in the plant and you're collecting, say, environmentals, how long are you out there how long is that first sample out there by the time you get it into the refrigerator? So kind of keeping that in mind, if you're out sampling for hours, that first sample that you've taken, that's also been sitting out there for a couple of hours. So making sure that you get those batched and refrigerated as quickly as possible. And then trying to get them to the lab in a timely manner. So obviously if it's a plant lab, that's much easier. But if you're shipping them to us, getting them here as quickly as possible so that that integrity and that sample isn't changed. So we want to receive an outwardly clean bag or custody cup, no cracks, no holes. If you're taking an environmental, removing that stick prior to it getting sent because your hand has been on that stick, so that is compromising the inside of that sample. Rolling down your Whirlpack bags numerous times to prevent things from oozing out. And then again, using a container with a good seal for water or liquid. Not recommending sending Whirlpack bags for liquid samples unless you are dropping them off to us, because typically those will be leaking and then we will be calling and telling you that we need a different sample. Another thing here too, not overfilling your bags too full. Sometimes in shipment, when they get kind of weighted down, those samples will start to also leak out of those bags. And there again, the sample is compromised and you want to make sure that that integrity is maintained. So you want to make sure you thoroughly wash your hands with soap and water before you enter your lab, in between batches of samples, and then prior to leaving the lab, and making sure that you sanitize all work surfaces, all equipment to avoid contamination of the sample or the workspace. And then sterile utensils or having the appropriate means, whether it's autoclave or alcohol and flame, to make sure that they're sterile in between testing. So if you have, say, a wrapped block of cheese, you want to sanitize the outside of the container with ethanol alcohol. That way, when you cut into it or you open it, whatever is on the outside of that packaging does not go into the sample. For liquids, we follow the SMEDP, so standard methods for dairy. And you're going to shake those, remove the sample with a pipette. Make sure you use a knife, a spoon, triers, whatever that is. And again, like I said in the beginning, think about collecting a good sample versus just the easy sample. So if you, for instance, say you have a bag of powder and you've been collecting throughout the day, making sure that you have a good way of really mixing or shaking that so that you're not just testing those top layers. You know, or if you have a large block of cheese, making sure that you just don't take from the one spot, that you try to take it from various different spots. Same goes for environmentals, you know, really getting under those nooks and those crannies. Because you want to take a good sample that is representative of kind of what's happening in that environment. And then for, like I said, for the dry ingredients, just making sure that you can really mix those well, so that you aren't just taking off of the top of that bag. Watching for incidental touches, that's probably one of the hardest parts, because especially for us when we're training, you may not even realize that you're doing it, that you're possibly touching something you're not supposed to do. So really watching when you remove something out of a package, whether it is forceps, that trier, for us spoons from a container, taking pipettes out, really making sure that you're not touching the insides of that packaging or the parts of the sterile item that are going to actually touch the product itself. When we talk sponges, you know, aseptically getting that sponge swab out of the bag and then putting that back in without having that whole stick getting inside the bag. So don't let a sterile item touch the opening or any place your hand touch. Like I said, if a sterile item touches something or you think it might have, just start over. And then once you remove something into the environment, don't put it back. So if you took out a pipette tip and you're like, oh wait, I forgot to open this bottle, just dispose of that pipette tip before and take a new one when you're ready. So when you're weighing, don't touch the sides or the outside of the bag, and that's where if you can possibly wipe it down with some sanitizer or some alcohol, that'll help. And then if you are taking a portion from multiple vats to do a composite, so for some customers, they will send us the composite, making sure that you have a new spoon or a cleaned trier for each vat so that you don't transfer potentially any of those bacteria from vat to vat. When we talk pipetting, a couple of key things. You want to remember that the actual pipette itself is not sterile. You can clean it, sanitize it. Most of those are not autoclavable. So if you want to think of it as that full plastic portion of the pipette is a potential contamination risk. So when I talk do not break the plane, that means when you are inserting your pipette with the tip into a bag or a bottle, making sure that nothing past the pipette tip goes down into that. And if you do, then making sure that before and after you sanitize that, the pipette cone before you go on to the next sample. We also here use filtered pipette tips. For anyone that does have the 3M pipettes, we'll go into that in a little bit more detail shortly, but they do have filters in them, which will help. But if you don't have those types of pipettes, recommend the use of filtered pipette tips. That just prevents sample from getting into that pipette, contaminating it, and potentially going on to the next sample. And then when you are plating, whether it's in the Petri film or a Petri dish, just again, making sure you remember that pipette is not sterile. It can be clean, but it's not sterile. So just having that pipette tip enter it. So after we've taken our sample aseptically and we're weighing it out, we need to make sure that we follow all proper mixing. So some use sterile blenders or stomachers, making sure if you have a dilution bottle or a dilution tube, either you vortex or standard methods 25 times up and down in 7 seconds in a 1 foot arc. So very vigorously shaking. You want to just make sure that, again, the bacteria are homogeneous into that mixture so that when you pipette out your sample, if it's there, you will find it. We also recommend once the diluent is added, plating within 15 minutes. Bacteria are going to start to replicate after roughly 20 minutes. So you really, once that diluent is added, the clock starts ticking and you want to get true representation of that original sample. So you really want to get those plated within that 15-minute time frame. And it's also important to be, because of those 15 minutes and you have a ton of samples to process throughout the day, it's important to be efficient, but also quality conscious. So not taking out all of your samples from the refrigerator that you have to plate for the entire day and having them sit out on your cart or on your counter, not adding diluent to 40 samples and having them stomach and then start plating them if you can't get that done within those 15 minutes. So really understanding your workload and how much you can do in a short amount of time and not temperature abusing those bacteria and those products. So again, once the sample is weighed, it's stomached, in a perfect world, miraculously, the sample would just get into the Petri film or the Petri dish. We wouldn't even have to open it, because every time you open something, there is a risk of air contamination or something dropping from your lab coat or whatever it may be. So you want to really minimize the exposure of how long those plates are open. So if you are starting to plate a Petri film and you get you make sure that you close that Petri film, the top film, the lid of a plate. If you get interrupted, make sure that you do those things quickly and get those closed so that it's just the sample in there. For anybody that does use Petri dishes, it can be very easy to switch the lids if you're not watching what you're doing. So really making sure that you have good documentation on your plates and your process to make sure that if I plate sample A in A, that's the one that is labeled. And then after incubation, knowing that those plates are filled with bacteria. So making sure that you take care when reading those plates, handling those plates, and the disposal of those plates. And then again, good cleaning practices, hands, and any of the surfaces that you've been using. So I know a lot of customers do use these 3M electric pipettes. So you all know, if you do use these, they're great. You can set them at multiple different volumes. You can make those dilutions, but so before you use, just making sure that the volume hasn't been adjusted during the cleaning process. Firmly place a pipette tip on, you hold that vertically, and then you go down 3 to 5 millimeters into the liquid. You don't have to go super far. Press the start button and allow that liquid to draw up. And then if you're doing Petri film, you hold it perpendicular to the Petri film and you press the start button until it finishes dispensing. So here they do have those filter tips in those cones. So you want to avoid that contamination. Again, once you pipette up sample, don't hold it horizontally. Always use the stand that it comes with. You want to have, we recommend, at least cleaning it daily, but make sure you have good cleaning practices and that you know that they're effective and stick to them. Clean the tip cone monthly or more often, depending. It all depends on use and what you're using it for. And really changing your filters if you're not. Everybody has a different frequency. You can put those into a little bit of diluent and plate those filters onto an APC Petri film to know kind of the contamination level. So if you do it, let's just say quarterly right now, the end of that quarter, you could plate that on an APC and see how clean or how dirty it is, and that may lead you towards a frequency change. And then these, you can also change the dispense speed. So if you're getting a lot of foaming or a lot of bubbles, you can change that dispensing speed. So these are the types of pipettes that we use here in-house. Again, whenever you are grabbing a pipette, make sure you check that volume. During the cleaning process, it's very easy for the dispense volume to change. So you're going to press the button down to the first stop. Again, holding that pipette vertically, you don't have to go too far into that liquid. Once you draw out the liquid, touch it against the side to remove any excess. And then you gently, at an angle, dispense down all the way to the second stop. And then you can release. So all of those steps, and I actually want to make one more comment about these pipettes. Not all pipette tips are created equally. Over the years, we have changed brands for one reason or another, and not all of them may draw up as quickly. The bottom of the tip can be a different size. So really watching that, and if you change a brand or whatever it may be, making sure that technicians really know, because sometimes you do have to draw it up a little bit slower or wait those like 2 seconds for the rest of the liquid to come up. So really just making sure that you understand the kind of tips you're using and how they work. So all of those steps that we have just talked about, like proper mixing, proper shaking within the 15-minute time frame. What at the end of the day, we want to make sure that we have good plates that are easy to interpret. And sometimes that just does not happen. So and those plates are obviously, they can be very difficult to read. So sometimes you'll have sticky cells that can be just improper shaking, not vigorously enough, not long enough. If you've shaken it and then you've let it sit too long, those are all kind of reasons for the cells kind of sticking together on a plate. When you talk Petri film, it could be that you use the wrong spreader. So for anybody that does yeast and mold, if you use that on the APC, for instance, or the APC spreader on the yeast and mold, you're going to get a very different surface area. So making sure that you're using the right spreader, making sure that you also don't read any colonies on those foam dams. So for instance, coliform E. coli, EB, any bacteria that are growing out on that barrier, you should not be reading because there are not enough nutrients out there for those to be counted. And then another thing, not stacking those Petri film too quickly. They need a good 1 to 2 minutes for them for that gel to form and to solidify before you move them. So that can also kind of create a different boundary line than what you're used to. For anybody that does do a pour plate, if you put your sample in the plate and you take too long to add the auger, Sometimes you can get clumping on the plastic petri dish. Too much liquid on a spread plate. Those are all just techniques, and like if you let it sit too long, that all just makes these plates very difficult to read, which then in turn will give you an inaccurate result. So when you make, if you have to make any cereal dilutions, for anybody that participates in proficiency, I know those are typically dilutions that most customers, ourselves included, are not used to typically doing. So really watching when you make those cereal dilutions, because so many different things can go wrong. You can not mix it properly, so not shaking it, letting it sit again, or you can have poor pipette technique. So you didn't let that full mill draw up, or there was a bubble in the tip, or you got some foam. Your dilution blanks, making sure that they are all at the same volume, because if one is 9 mils, one is 8 mils, or one is 99 mils and one is 105 mils, that can really throw your dilutions off. If you're doing a large dilution scheme and you get interrupted, where was I? Which one was I on? Did I do it twice? Did I miss one? And then just, let's say I plated 10 to the 2 on that 10 to the 4. So just really making sure when you do those dilutions, everything is labeled properly, everything is labeled clearly, and you have that focus to really make sure you're plating the right sample into the right plate. I'm going to briefly touch on just some of the basic colony counting rules, basically how to get you to our end result. When you're reading, especially product samples, avoid mistaking particles of sample as colonies. So really using your colony counters or microscope if you need to, or some sort of magnification. And I tell all attendees at Cherney College or whatever kind of class, we follow rules from standard methods for dairy and the compendium, but just making sure internally you establish your rules and you just consistently follow them is the key, because not everybody does it the same. It depends on their sample type or their dilution scheme, but just making sure that within your organization, everybody follows the same rules. So for us, we're going to report the final results to 2 significant figures, and that's just to avoid the false impression of precision and accuracy. There are so many variables that come into play that micro is not as precise as chemistry. So we are going to round to 2 significant figures. So there's some examples there, the 1270 up to 1300. And then after we count, the rounding is always going to be the final step. So we're going to take our count, which is the actual colony count times the dilution factor. And then we're going to also yield, if you get results from us, you may or may not see an estimated sign. Has a lot to do with the countable ranges. Every test, every bacteria method, they will have different countable ranges based on the surface area, based on the bacteria that you're looking for, the size, the growth rate, all of those things. So we're going to use and try to find a plate within that countable range, and then take that count by the dilution factor. And then we'll report it as CFU per gram or per mil. And then if you do something in duplicate or triplicate, either you're adding those up or you're averaging those. Okay, so that is micro. Now I'm going to, like I said, go on to just a couple of the more common chemistry tests. But the difference is, so a lot of internal labs, you will probably have the same technician handling both samples. And the kind of the requirements of the aseptic technique are they're different between the two. So risk of contamination. So as we have talked now, aseptic technique, super critical in micro, that can very greatly change your result. It's important for chemistry, but it's not as critical. A staff count probably isn't going to change your protein result, for an example. Room temperature samples, most chemistry methods are going to require that the samples sit out at room temperature before you start testing them. As I've also said for micro, this isn't acceptable because after 20 minutes or maximum of 20 minutes, they're going to start to replicate. So you really want to get that sample out of the refrigerator for micro and set up as quickly as you can. So if you're doing micro and chemistry, really making sure you do your micro first and then your chemistry results second. And then we will talk for chemistry, a lot of samples need to be ground up into fine sizes. It can be hard to sterilely do that on the micro side. So that's where we take small representative portions. So for chemistry, prior to testing, make sure the sample has been mixed thoroughly. So if you're grinding your sample, you want it uniform size. You want to make sure though that you are not grinding that sample for more than like 15 seconds because the heat of that grinder can separate the fat out of the product. So kind of pulsing it and getting it to that uniform size. Really stirring and shaking liquids well. If you're testing for chemistry, any sort of milk or cream or ice cream or anything to that nature, making sure that those layers don't separate. So whether you have to keep it in the water bath, but then really making sure that you shake it right before you pipette out of it. Stirring, shaking those powders. Again, if it's a composite, just making sure you have a proper container size or transfer it to a different size so that you really can shake it. And then creating a paste out of meat if you are testing something like that. So again, like I said, prior to weighing, you're going to want those samples to sit out at room temp. And then, so if you have to do micro and chem, do your micro first, then your chemistry. If you have a moisture test, do your moisture test first for the chemistry side. Because opening that sample bag for too long can really change your moisture results. So when we talk moisture, it's a very, very simple test. For those of you that do it, you know that it's a very simple test, but there can be a lot that go wrong. Incorrect sampling procedures can introduce that error, leaving your bags open for too long, not getting a representative sample. So there can be potential moisture variations within blocks of cheese. How it was cooled down can really affect that temperature also. So really, again, not just taking one simple, easy sample, but maybe taking it from different spots within your block of cheese or whatever that product type might be. And then we'll go on to pH. You want to, again, all of these are critical to stir and mix well. You want to make sure that you have enough sample so that when you put that probe in there, it's fully encased. The probe is fully encased around that product. And pH is very, temperature is very critical for pH. It's very temperature dependent. So if you have a higher temperature, you're going to have a lower pH. So you want to either make sure, again, that they're at room temp, or you have a pH probe system that can adjust the temperature and compensate for it. Another critical piece for proper pH is making sure your buffers, that they are not good forever. So if you buy a 4-liter gallon of a pH buffer, it will not last you until it's empty. As it's exposed to the air, to temperature, to time, they will start to degrade. So really making sure that you also have the right electrode, you have the right buffers to get you your slope, so low, medium, high, and a check, and that there, you can test the right product sample or the right sample size and handle it all right, but if you don't have this piece, you're going to get an inaccurate pH result. We get a lot of questions on Babcocks, especially when they've come to our chemistry courses here in-house. That's typically the method that most want to see, because it is very, very technique dependent. It's not a hard method, but how you handle the acid, how you take the temperature, the rate of your swirling, it's very technique dependent, and every technician can do it a little bit different. It also varies based on the acid lot, so it can change slightly from those, So just really making sure that you hit that temperature in a short amount of time, and that you check that temperature for each sample. Also knowing that higher fat, you might need to shake it longer, or you might have to add more acid. Simple test, but it can be hard to read these. So making sure that you do have the appropriate equipment, and or if you've got somebody tall reading them versus somebody short, making sure that you've got a good space for everybody to be able to do that at eye level. And then making sure that you add the right acid, not too much, not too little, not interpreting burnt columns, making sure that if you recognize a burnt column that you start over. Last method that I'm going to kind of touch on is our salt method also. That's another one that people really like to come in and see because they have questions on it. So here you're going to grind that sample again to uniform size. We're going to weigh it out, add some warm water. You're going to blend it. The key piece then is letting it sit for those 30 minutes to really get those salt ions to separate out from the actual sample. A lot of customers or labs that have come to see, that's a piece that they miss. So really making sure that those sit for those 30 minutes. Another piece with salt, I can attest to this, the pipetting technique can be extremely difficult to learn because it is so critical to your result. So you want to make sure that you have no bubbles, you rinse your tip several times, make sure any little extra droplet can really affect your result. Make sure your standard, your buffers, all of those are fresh, clean electrodes, and condition when you're supposed to. But the pipette technique, that's probably the hardest for reproducibility. So making sure that your technicians really are comfortable and they have the technique down, because that can really affect your salt result. Okay, so that was the presentation. If you have any questions, don't hesitate to contact me, Matt, Warren, whoever. There's my contact info. If you guys do or don't have any questions, we'll stay for a little bit, but thank you very much for attending. The next webinar will be November 18th. This is going to be on Petrifilm use and interpretation. So all things Petrifilm, handling storage, the setup, and we will focus heavily on the interpretation of some of the different Petrifilm. Specifically, I know we've been getting lots of questions on yeast and mold versus rapid yeast and mold, and then EB Petrifilm. So we'll have lots of different pictures on how to interpret and why we interpret a certain way. So let us know if you have any questions.